Name is Marat Fudim. I'm a heart failure cardiologist and an AHA member. I'm also part of the Healthcare Technology Innovation and Innovators Network. And today we will actually be joined by two members of that same network. And I'll be introducing to you shortly, but I want to tell you a little bit about that network. It has now over 60 members, and members really means that these are mostly represented by companies. These companies build solutions. They're eager to collaborate with the American Heart Association, but specifically with the members of the American Heart Association, which are the ones listening to this talk. I would like to point out that these industry partners or partners from different walks of life are really interested to collaborate with us in research, clinical validation. There have been very good examples because we have done this recording several times in the past with prior members of this health tech innovation group, where it can really span anything from being interested to collaborate and find population to test it in, to roll it out into commercial settings, to get scientific input, to find content experts. And that, of course, is, if you think of cardiovascular and neurovascular space, that's the home of the AHA. So I'm excited to introduce to you all Stephen with Tabia and Steve Pickett, and he'll introduce him shortly, and then also Jani Tuomi, did I say it right, with SensaBio. So why don't we just quickly jump in that you guys introduce yourself, A. B, if along the way anybody has any questions, just put them in the chat. We can try to address them during this call. And so go ahead, Steve. Why don't you give us a little bit of introduction of what you're doing?
Yeah, thank you, Marat, and thank you everyone for joining. So in terms of introductions, I'm one of the co-founders of Tabia and the CEO of Tabia, and we established a strategic relationship with the American Heart Association. It may even be 2 years back, maybe even a little longer than that, and it's just been a wonderful experience that has helped us help our customers as well. And so at a real macro level, what we have built at Tabia is a care orchestration engine that was designed and is operating in a way that we can manage any patient, anytime, anywhere. And specifically, when that patient is a cardiac patient, then we have the benefit of having the American Heart Association care plans on the platform, digitized on the platform, and educational content from the American Heart Association on the platform. And that can be used to essentially automate the care coordination function with patients and get them educated on a real-time basis about their condition. And we can do that in a way where we use AI agents collaborating with people to move patients through the care journey. And we can do that, by the way, with AI agents who can make phone calls, send text messages, send WhatsApp messages. And it's not only about coordinating the care. When do they need to come in for labs? When do they need to come in for imaging? When do they need to come into for an appointment? But it's also providing the right education at the right time. And that communication can be done in any language. And what we're generally finding is that there are better patient outcomes when the patients are managed digitally, and with some level of automation, and when you're communicating with them in their preferred language. And so what we're seeing are things like lower no-show rates because of that high level of touch. And that's partly because people understand why they need to come in for the appointment. Not just the appointment has been made, but it's their appointment with this doctor, and here's what needs to be accomplished at that particular appointment. So at a real macro level, think about the navigation system you use in your car to get you from point A to point B is now available through a strategic relationship with the American Heart Association for any of your cardiology patients.
Excellent. And I'll get back with some initial questions before the audience gets to raise theirs. But maybe we jump then next to Jani to give us a little bit of insights about what they do in his company.
Yeah, exactly. Thank you. And just like Stephen said, great to be part of the Innovators Network. My name is Jani. I'm one of the co-founders of SensaBio. I come from a background of what I call data diagnostics, certainly from the CAP CLIA side of things. And then 4 years ago, I actually started wearing a Whoop and really seeing, potentially where PPG and the optical sensor capabilities can offer insights. But at the time, a lot of these consumer grade wearables aren't offering the level of insight, detail, high frequency that I would have expected given kind of the clinical background I was coming from. So we started Sensor Bio through an acquisition of a 9-year-old company that had been building high frequency raw PPG sensors. And we're taking that now to market with our clinical partners. So think about it, that Sensor Bio can give you this video, high quality optical resolution of the heartbeat. And when you're really looking at that with high resolution, high frequency, and raw PPG, you can see things that typically consumer wearables haven't seen. And especially in a world now where, wearables are starting to proliferate, these can become early screening devices. We're starting to see so much more insight from the heart. And of course, we hear the FDA talking about loosening up regulations around wearables. So think about Sensor Bio as that clinical partner in the wearable space. And we'll get into the meat of this more and what that means. But nice to meet everyone.
I mean, it's fascinating. Actually, we had a number of these calls, but these seem to be like very nice and complementary strategies. You have the hardware that gives you clinical insights, can be deployed from, as a prescribed tool in lifestyle, also something you acquire through the lifestyle market and then give physicians actionable information. And then you have with Tabia, the the integration of that information into the clinical healthcare system and make it maybe also actionable and allows for close loop communication. So I'm curious about maybe to start with Tabia. You already integrated into healthcare systems with us, right? This is not just a hypothetical.
This is not just a hypothetical. Yeah, as a matter of fact, to give you a sense for some of the organizations where there have been public announcements that we're working with, we just about 4 weeks ago made a joint announcement with Mayo Clinic. So not only are we working with them on a couple of different implementations, we're also going to market with them as a partner. Today, we have about 15 million patients that we have visibility to through a variety of different EHR integrations. So yeah, it's definitely a mature company at this point. And Marat, to maybe comment on your last comment related to devices and how do you get that data to be more easily digested by the healthcare system? So in addition to us managing the patient through their care journey, we also have the ability to keep track of how they're doing in between visits. And even when multiple devices are used to keep track of the patient, we're going to make sure that data is available on a single pane of glass for that care provider to be able to get a sense for what's happening with that patient in between visits. And that can be coupled with things like surveys. How are you feeling today? How did you eat today? So there can be regular communication with the patient that doesn't require an enormous staff to do it. That the AI agents can go have that dialogue with the patient and bring that knowledge forward into the healthcare setting.
Well,
And Marat, you're unmute
Steven,
there.
that's like, I want to almost pick, like just right off the back of you, when you're getting the patient's perspective, their sentiment, some of their qualitative perspectives on these, what we're seeing is the marrying up of that with what's actually happening inside, right? So we're seeing HRV trends, we're seeing autonomic nervous system. And when you put those two data sets together, we think that that's exactly what is needed in this data-driven healthcare world. So I'm just responding to what you said. Tabia clearly does something that we don't. And what we're trying to get out there is filling some of the areas with some high quality data to support this, and not just the annual blood test once a year type of data set, but this trending and just ever hyper accurate 24/7 set of data points. So
Yeah, which is such critical data, of course, right? So yeah, I think there's a strong alignment between what we're trying to do to really provide maximum visibility to healthcare providers that should result in much better health outcomes for our patients, which is what we're all mostly focused on, right, at the end of the day. And essentially what we've done is, right, we've digitized these care pathways from the American Heart Association, the educational content, and you can use it in a more real-time basis, and in an automated way, to more effectively move patients through the care journey and deliver what ends up being much more adherent care as well, right? Not only taking the right steps sequentially, but also taking those steps in a more timely way because you're keeping track of the progress digitally, much like, again, to use my analogy of a navigation system on your phone, the navigation system knows when you stopped, right? And it's going to help you get started again once that time is upon you. And if you make a wrong turn, it's going to recalculate and figure out how to get you to that destination as efficiently as possible. And that's essentially what we've built here. And of course, doing that is not just knowing what's the next appointment, what's the next blood test, but what's happening with that patient intermediately as well.
So now we got an idea of what you are doing at your respective companies. You have been part of this, big network where you theoretically have access to thousands and thousands of cardiovascular, neurovascular professionals. The cardiac metabolic space is, diving deeper into the AHA as well. Where do you see the best intersection with the community and constituents? Like, what would you love to see? Because you have an audience here live, but also as it later will be shown in a recorded fashion. When they reach out to you, what is it that you seek from these individuals?
I'd say, go ahead, Jani, please.
Oh, okay. Thank you. Well, for us, we've obviously got 400 million hours of data. We have, unique perspectives. We have the support of the FDA, whose words from Dr. Marty are, let the market decide whose PPG wearable is best. And we have RTM codes today that are available to be able to do tracking like this. RPM, of course, probably catching up a bit. So for me, if I had this ask, like you said, Marat, we're looking for pilot sites. We're already working with several systems. We have, some KOLs popping up, becoming very astute in terms of what PPG can and can't do and where it's going. And so we're continuing to build up our KOLs and COEs, and we'd love to get some more centers out there because we do see these devices as their prices come down and the data continues to proliferate, offering a lot of opportunities. So yeah, CO.
Okay, so I hear users, content inputs, help you shape the market, define the market, those type of engagements. Are you also, and this is maybe to give Steve an idea that came up on prior calls, do you have granting opportunities? Do you seek out to hand out just free devices, which I often hear from industry partners in various stages, or you actually have some way to actually collaborate and sponsor research?
Yeah, actually, it's interesting on the research side, we actually have a lot of PhDs coming to us with grant dollars. Then so on that side, the dollars are coming to us and we're moving product over. But on the clinical side, we're already working with a couple different institutes. I think they're probably members, and their cardiologists are members. But yes, we are then providing, 5 or 10 devices to go generate data and to create education together. So.
Okay. I want to be in your shoes one day, people coming to me with money. It's great. All right, Steve, what about you?
Yeah, I'd say, first of all, we started with this company partly driven by a quote from the World Health Organization that goes something like this. The single most impactful way to improve human health worldwide isn't necessarily the discovery of a new drug or some type of new treatment plan. It's just getting people to better adhere to the scientifically validated treatment plans that we already know about. And what I typically find, much as I see you doing, Marat, is people nod their head and say, yeah, of course we want to do that. I think heretofore, people haven't really considered what digitalization and what automation through a navigation system can do to improve that. And so our primary mission is to try to get out to as many users, whether it's a cardiology group that's part of a hospital or whether it's a specialty cardiology group, and just make sure that those users, if you will, know what's out there, so that together we can make the biggest impact on human health that we possibly can. And again, it's just in my mind, it's about digitizing these processes that are so often manual, and then increasing or in using some level of automation. I'll share with you, I don't think this is ever a part of the business process that is going to be 100% automated. You need people in the loop. But the reality is there are people in the loop today who are doing things that are rather mundane, who are getting in the way of having enough time for the nurse navigator, care coordinator, or nurse to really engage empathetically with the patient. And so if those mundane things like get the patient scheduled, do it in the right language, can be done in a more automated fashion, it creates a bit of a flywheel effect within doctor groups or in hospital systems. And the reason I say that in terms of flywheel effect is that we're finding in our deployments that when we help at this administrative layer manage the patient day to day, and we're doing that digitally, we free up capacity of that administrative group. And what we have found is over time, because this administrative layer within many of your organizations has been understaffed and overworked, a bunch of the administrative functions have actually moved up into the nurse domain. And because there's a shortage of nurses, some of those administrative functions have moved up to the doctor domain. And so what we can do is by making that administrative function operate better, you can begin to pull down some of that administrative work from other layers in the organization. And that can create it can create a situation where people are more commonly working top of license. So mostly our focus is how do we find users so we can do what we all wanted to do from the very beginning. I mean, not just the Tabia team, but all of you on the call as well, which is really focused on trying to get optimum health outcomes for our patients.
So now through I'm just looking back my notes through the web link that I showed you earlier. We will have it up again. First of all, you can find the web link to all the companies as part of the Innovator Network, because I'm just wondering right now, how will these individuals from the AHA actually connect with you all? They can certainly do it through the web link on the AHA web portal and get back to you all, and hopefully you will be very responsive because there's quite a bit of interest in the chat. Are you able to see the chat, by the way, that's going on in parallel?
I cannot see the chat. That's
Okay,
probably an operator error. It usually is. But I'll take a look.
You're supposed to be the techie guy. No, but it's
That's right.
the opportunities for collaboration. I mean, that's one of the questions asked again and again, is that where, I guess it's you are open for collaboration. It seems like, Steve, for you, it's really use cases. It's maybe less quote unquote traditional science. And I do think that a lot of the AI and the EMR use case scenarios that we see being integrated with healthcare system really just use the practical implementation rather than the traditional research approaches and grant funding supported work. And then another question specifically raised towards Jani was, see if I can say so many coming through now.
Yeah, and I can now see them. I did move out of full
Perfect.
screen, so I can see them now. So
The educational opportunities, Jani, that you mentioned was piquing Just Deep's curiosity. What do you have
Yeah,
in mind there?
I see that. So I'm just going to pull up one of the ones super quickly here if I can
Do
get
it.
it. The number one question we get asked all the time around, wearables. Of course, it can't come back fast enough here, but so I think the idea certainly is that there's a lot of education, not just here even for the patient, but for the clinician, whether it is understanding how wearables might fit in a clinical protocol. It does the data, you know, allow for reimbursement? What does need to be
Mm-hmm.
captured for RTM versus RPM? Where does ECG play a role in here potentially for things like ACM? So there's a lot of, I think, catch up, but what we're seeing is that the FDA has done its first part, right? Just because it says, hey, wearables are now allowed in a clinical setting without a 510(k), so long as there's a doctor requisition, that doesn't mean the gates flooded open and everybody's doing this. But that's a huge first step towards building up clinical adoption. And so again, when Dr. Marty says, from the FDA, hey, we're going to just let the market decide. Well, what attributes are we going to let the market decide, right? So let's start with educating doctors on what matters, right?
Mm-hmm.
A lot of consumer grade wearables have focused on the really easy things, right? Like heart rate, steps, and sleep staging. But
Mm-hmm.
sleep staging especially if somebody doesn't have sleep apnea, does it really matter if they got 52 minutes or an hour 8 of REM? And what does that really tell the user? So I think for us, we're trying to build, this next layer deeper of insights and perspectives. So I think there's a lot of education on just what we'll call wearables 101, and I'd love to work with select AHA members, the innovation group, and of course the AHA itself to potentially create such a dictionary of like, wearables 101. And then we
Okay.
can go from there. Does
Yeah.
that answer the
So,
question?
no, I think that's very good. Yeah. So question for you all, where do you actually see the value beyond the members itself? And I do think 99% of the value of the AHA are its members, but where is the AHA with its existing guidelines and protocols? Where do you see value both for your view in that in itself beyond the members? Like
Yeah,
why
so
AHA? Why not some other organization?
because they have the scientifically validated care plans, and we collaboratively with the American Heart Association decided that digitizing those and using agentic AI to execute those steps, including the educational
Hmm.
parts of those steps, it could add real value to the members, and so that's why we came together with the American Heart Association. But it's that enormous body of research that we can digitize and turn into real deliverables for cardiologists. That was also important, beyond just the members.
Yeah, and Steven says things so well for me, so I'll just say what he said for us as well. But I'm gonna add one more thing very specifically to us. Just like how A1C is a very powerful trending marker compared to real-time glucose, I think we see the same opportunity for HRV. And so, every night you go to bed, you get your HRV and you're like, wow, okay, 52, great. What is this number in this isolation?
Hmm.
But I think that there's the equivalent A1C trend line for HRV as well. And so if we can create a clinical digital biomarker, maybe the first of many, that can say, hey, this is a screening marker. And if we now know this number, it in one glimpse can say, okay, I understand your age, now your HRVC. I can very quickly, correlate that to bodies of evidence around average HRVC per age. It can, there's strong correlation to BMI around this and stress. So in one number within a few seconds, that number can become useful, almost like an A1C. So I believe that again, working with the AHA, we can start education and potentially create an adoption of, potentially this clinical digital biomarker. So
I like it. Carly is asking if you obviously have a lot of partners you have been around for years. If you to collaborate already with somebody in a specific institution, how does one find out that you already have institutional relationships with, let's say, the Duke of this world? How do I find it out? What would be the best way?
I would say, in terms of Ms. Tabia, please reach out to me. I'm happy to, make those connections, and I'll highlight that that is absolutely possible, right? So sometimes when we engage with a health system, again, hospital specialty groups, we might start in one particular area of specialty. Let me just say renal
Hmm.
care to be arbitrary, and we might not have gotten to the cardiology group yet. So if you
Hmm.
reach out to me, it's Steve at tabiahealth.com, and I think Laura was going to send a QR code out as part of the follow-up here that you can click on to get directly to Tabia as well. So just reach out, and we're happy to make the connections if those connections don't if those connections already exist. And if not, we're happy to talk to you about how we might be able to work together.
John put a QR code in the John with AHA into the webinar chat, but I'm unable to open it. I don't know if any other person can open it, but that would be very exciting. I would be not surprised at all if next door the kidney doctors that are sitting next to me are using Tavi. I'm not aware of it, because we are so heavily siloed that even within cardiology we might not be aware of. So that's your Tabia, and then we have the same thing by chance for Jani. Or did Jani skip the opportunity to throw a QR code at us?
I might not have been that advanced. We're pretty new to joining your innovators
All
network.
right, man. You have to send us the watches then instead. We'll have to
Yeah,
Google you.
exactly. You
Send some
just,
bio.
yeah, exactly.
So I'm curious. By standing out, I'm actually very familiar with that market. Have a number of these type of watches. Including Actia is one of them, and you mentioned the Whoop, et cetera, et cetera, et cetera. How do you, beyond the science, do you think the physical appeal of that matters a lot as well to your customers? Like, how do you weigh good science versus the appeal of the actual watch? I have a lot of people that tell me how great a Whoop is and how comfortable it is. Yet then, you might note that it has certain deficiencies and some things that can be overcome. How do you weigh those things?
Yeah, I think the thing we've heard loud and clear is that this device needs to be passive, much more invisible. It shouldn't flip over on your wrist when you're swimming. It really shouldn't be something that draws attention. And to that end, that way it can quietly sit there and do its thing. It shouldn't slide up and down. So there's a lot of research over the years that we've put into the band design, into the even the way the tub of the device sits into your skin and is able to sort of block out outside optical light, that can interfere with the noise. So we've put a lot of what I would call UX design.
Mm-hmm.
While it may not have the flashiest screen like an Apple Watch Max, it has 8 days of battery, right? As a result of being very small and very light. And so we've really built around that clinical user's experience. Choice of even, for example, silicone bands that have no PFAS and just are very, very comfortable to wear
Mm-hmm.
24/7, even if you're sweating or have different, arm demographic types. We've tested it with just a variety of different people's skin types and, what I'll just say is demographics around that. So I think we've really, really put the UX to work, but not from the typical consumer attributes, which are the cool factors and the flashy ones.
Yeah,
They're just end user desire to maintain wearing it. Because we've learned from the payers, if this device is not generating data, then they're not reimbursing. So
correct.
we have to be able to make sure this device is collecting it.
Cannot be just looks. And Steve, we are short on time. Maybe also a quick question to you. Do you seek input from these AHA members around usability or you got the perfect product and you don't need no any input anymore?
We're definitely looking for constant feedback, right? Because we can always get better. I did want to add something as it relates to the devices. I think all of us know that if an RPM is prescribed, there's an opportunity to actually charge for the use of that RPM. And in this moment in time, 16 measurements are required monthly in order to do that billing. That's something else Tabia can help with, right? It's going to know what's been prescribed. It's going to have an interface to the cloud with the device to understand when it was used, whether it's getting readings, whether this be a blood pressure sleeve or whether it be something as sophisticated as what Jani has. And so we can send reminders. Hey, we usually see that you've taken your blood pressure at 8 o'clock in the morning. It's 10 o'clock. You haven't gotten to it yet. Just a reminder. Dr. Marat wanted you to do this every day so he can keep track of your blood pressure in between appointments. Please don't forget to do it later on this afternoon, right? Those are the kinds of reminders that we can do to bring that capture of data in between visits to bear more frequently.
Well, I'm very excited that we had half an hour to spend with each other and, specifically to present the two members, the two of you of the Center for Health Technology and Innovation Network. So we hope that people will look at this recording, that they will reach out to you all. Don't be shy. These two gentlemen are very approachable. And you build active collaborations, beyond science, help with implementation, and give this gentleman some feedback on the companies. And you on the other side also reach out to us members in the AHA and seek for the deep expertise that we all have. I'd like to thank you all. Hope to run into you all in the near future. Best of
Thank you,
luck and
Marat.
success to you all.
Appreciate it. And thank you everyone for joining. And thanks for to the AHA for everything you do every day for patients and for members around the world.
Appreciate the kind words. Thank
Thanks all.
Take care.